Amy Gomlak. I am one of the board members here at Buffalo Prenatal Perinatal. And today we have a really exciting sharing for everyone. But before we do that, I wanted to introduce Luann, who many of you know as our president and CEO of our organization, and Denise, who keeps us all in the line, quite frankly, and several of our staff members. But we'd like to go around the room so we can introduce everyone so we all sort of have a context of who's here. So we'll start with some of our staff members.
I am Ikea. I'm one of the supervisors in the community health department. I'm a PhD subject community. And Ricky Korea, I'm the program manager for the Health Family Hospital program. Megan Saunders, I'm a public health fellow with the Buffalo Prenatal. I'm Ariel Naylor, social grant hospital.
Home and family, also social work at our son's child school. I'm just the intern here. UD student.
It's not just.
It's not just an intern.
It's so helpful, especially with this event. So no, thank you very much.
You guys want to look against the wall, maybe? Okay, William, do you want to start?
Megan Winter, I work for Councilmember Farrelletto of Delaware. Mallory Melia, I work for Councilmember Rivera. Danielle Ravillo, I work in the County Health Department in the Office of Health Equity. And I work with Health and Western Oregon Care Network. I'm Helena Dola. I'm a professor and chair in the Department of Epidemiology and Environmental Health at UB. And I'm a reproductive perinatal epidemiologist. I'm Jessica Falls. I'm from Senator Tim Kennedy.
David Hayes, I'm on the board for the full prenatal care.
Danielle Bowell, I work at Rich Products and community engagement. I'm Rachel. I also work at Rich Products and community engagement.
All right, to our Zoom friends, if you'd like to unmute and just say hi. Don't be shy. Mike, you want to get us started?
Yeah, Mike.
Hello, this is Mike. I'm the finance manager for Buffalo Prenatal.
Alex.
Hi, this is Alex Gross from Senator Sean Ryan's office.
Great. Oh, we have another board member, Kim. Want to say hi?
Good morning, everyone. Kim Adams, board member.
Kendra.
Hi, everyone. I'm Kendra Hogan. I do outreach for the Catholic Charities WIC program.
Oh, another board member, Jason.
Good morning, Jason Daniels. I'm a board member.
And there's someone who's just a bunch of letters, so I'm not sure who you are. If there's anyone else who hasn't introduced themselves, please do so.
Good morning. This is Waikita, newest board member.
There you are. Hi.
Okay.
All right. Yeah, you're the Y. All right.
Okay.
I didn't get the full. It was hard to see. Welcome. Did you miss anyone?
Yep. Good morning. This is Keenan Gibbons with the Community Engagement Corps with the UB CTSI.
All right. Is that everyone on Zoom world? I think, yes. Doing none? Great. Well, thank you for joining us on Zoom world as well. Hopefully, I know it's a little hard to hear our audience. We'll try and repeat questions when they arise, and when you have questions, raise your hand on Zoom world, and we'll incorporate you. But we'll get started. Thank you all for being here.
Thank you all for being here. I'm going to turn the program over to Luann Brown, our leader of our organization, but I want to say thank you to everyone who took the time to be here, took the time to park and be here and make it up 4 flights of stairs and be here. Our organization is small but mighty, and the work that we do is really tremendously important in our communities. And Luann will be talking to you about a number of issues, but one of the areas as a board member that really means a lot to me is to have our staff members come from the communities that they serve. We have 6 open positions, So if you have individuals in your organizations, friends, a family, especially those who we serve in the zip codes we serve, and we have some information if you're not sure what those are, we'd be very happy to provide you with the job descriptions, et cetera, and post them. We find that the most success that we have are people who have either been in our program or are proximal to our program and are aware of the great work that we in fact do. So I would appreciate that. And thank you. Tim Kennedy's office has already stepped up and said they will post to about 1,000 individuals.
Oh, good.
Okay. So I'm going to turn over the program to Luann and thank you. Oh, I apologize. Yes. So actually everyone received, if you haven't stepped, when you picked the paper up, when you walked in the door, we have what we call an engagement survey. And what we are looking to do is see how anyone in this room can become connected to us in some way, and or your families or friends or churches or organizations. And so the grants that we receive are super important. And as many of you probably know, the wages have increased and our grant funding for wages has not gone up as fast as our demand for wages. So grant programs that help us to support our staff are super important. Letting everyone in your community that you work with know about our programs. That would get you on the mailing list. Make sure you can put things in your church bulletins, in your own newsletters, on your websites. Let people know about the great services that are provided by Buffalo Prenatal. And you yourself and your organizations take credit for making those referrals, because your constituents and our constituents together will make a stronger community. Every year we adopt families. We have our caseworkers and our family support specialists are actually in the homes. They know what the moms and the families and the dads need. And we provide a very specific list by age, by name, by size. And if you want to adopt a family, I can tell you that every year I have a ball with this. And so if you're interested and you want to go kind of hog wild and you don't know what to get your spouse or your significant other, buy them and adopt a family for them, because it really is one of the more meaningful things we can do, since we all have more than enough stuff in our houses, I'm sure. Diapers, wipes, we'll take them. Anytime you want to drop them off, I'll come to your house and get them. New and used good condition furniture, household supplies. If you've got some chairs in your basement, I just cleaned out 2 beds, a dresser, a bunch of cleaning supplies I didn't know I had, clearly needed to have them. And we are able to provide them to our family. And if you have furniture, we have a wonderful organization that is a moving company that will come and pick that up at your house.
Wayfinder Moving. I'm giving them a plug.
Wayfinder Moving.
They're on the screen too.
That's absolutely fantastic. And they came, I put everything on my porch, and beds and frames and dressers and chairs, and it disappeared. And my house was cleaner.
There it is, Wayfinder, right there, right behind you, right at perfect time.
Look at it. So certainly, if you would like to come at any time and present what your organization does, or if you want to do a study with our staff or at the university, come and meet with our team. The more our team members know about your programs, and the more therefore you know about our programs, then we're all more in lockstep together to serve the community. And we will always be interested in adding to our board of directors. We have positions on our board that you would be attending and being very active. And we also have the opportunity to be an honorary board member, where if what you really want to be able to provide is your influence on the board without all the obligations of being at every board meeting, I would be very interested in talking with you about that. And these gentlemen are here to say hello as well.
Introduce yourself as you're walking.
Hello, I'm Mitch Nokowski, I'm the Philly District Council member.
Hello.
I'm Jake, I'm with something over my office.
Terrific. Thank you very much. Okay, turning over to Luann.
Thank you, Amy. Now, Amy did not say she's actually the board president. She said she was a member of the board, and she's going to be a wonderful president, as we can tell. And we actually have 9 positions open, because we have 6 in healthy families and 3 in community health workers. So, and we actually also have 2 supervisory positions open. So if you know somebody, please send their names to us. If you picked up the bingo card, this will be later for prizes. We know people like prizes. You just need to answer the questions, and then we'll tell you if you're right or not. So good morning. I'm Luann Brown, the CEO of Buffalo Prenatal Perinatal Network. I'm just going to give a brief history, because some of you have been here before and know us, and perhaps some of you don't. But generally, we have been around since 1987. We were actually, you can tell how old we are, because we were started by Governor Mario Cuomo. he was very concerned about the high risk births, the high rates of infant mortality and low birth weight rates in New York State. So he made 16 networks. I think we're down to 14 now, and we are one of them. We are one of the original ones. So that's kind of our primary focus, but we have over the years, actually 5 years ago, have added our fatherhood component because we felt dads are just as important to the family. We serve primarily the east and west side of Buffalo, but Healthy Families does go into other areas. We are in Cheektowaga, Lackawanna, a little bit of Tonawanda, a little bit of Hamburg. Just for your information, 68%, 17% of our referrals come from zip code 14215. 15% come from 14211. 7% come from 14207. We have all the data on this. So we primarily focus on African-American and Hispanic moms because they tend to have the higher rates of infant mortality, maternal mortality. We have 3 programs that you're going to hear from today. We have our Healthy Families New York program. Our 2 women's programs have been in existence over 20 years, each of them. So Healthy Families New York is one of them. We are the largest Healthy Families program in New York State. We cover about 400 families. We have our pitch, which I'm not going to even go in that acronym. I call it our Community Health Worker Program, which is funded by the New York State Department of Health. Healthy Families is funded by the Office of Child and Family Services. Community Health Worker Program works with similar populations. And then we have our fatherhood program, and you're going to hear from, those managers. And we actually have one of our employees who was actually in one of our programs, and we have a fatherhood rep to speak because I think they can tell our story better than I can. So to start off, I'm going to start with Anne-Marie Correa, who's our program manager for Healthy Families.
Yeah.
You said just switch with Amy. Yeah.
Good morning, everybody. So Healthy Families New York has been around since 1995. It was developed to work on preventing child abuse and neglect. The reason being that studies started to show that the higher stress levels in a family, and when I'm talking about stress levels, I'm talking about, where my next meal is coming from. I'm dealing with some domestic violence. I'm dealing with substance abuse. I'm dealing with, I'm gonna be evicted. Those types of things. The higher the stress level in a family, the more likely they are to be unsuccessful as parents. The families that are, usually submitted for reports to Child Protective Services are highly stressed families, and not all of them are severely abusing their children. Sometimes they're just very distracted by what's going on in their life. So what OCFS was trying to do was prevent that. So it's a prevention program where we want to be proactive, not reactive. So that's how Healthy Families developed. And it started with actually a study out in Hawaii. There was a model that they studied there, and it grew and became Healthy Families America, which is a national program. And Healthy Families New York is one of those programs, one of those entities within that national program. There are probably about 48, I believe, programs in New York State that are Healthy Families. And as Luann had said, Buffalo is the largest. So we have 4 goals. I have to have a cheat sheet now. I'm old. Like I used to be able to rattle this off, but now I got to look. So one is support positive parent bonding and relationships. So how do we do that? We bring out an evidence-based curriculum that we use. Our staff do lesson plans and go out into the home. And what we're trying to teach parents is what to look for one thing in their child's development. Is their child on task? Another is to understand what their child is doing and why. Your baby's not fussing and crying in the beginning because your baby hates you, or that you're doing something wrong. That's a signal, that's a need, that's a survival instinct. So we want to teach parents how to recognize those cues from their baby. We want to teach that they're their child's favorite toy, that they don't need to have the most expensive toys to be a good parent. It's about bonding. The first thing is feeding and making eye contact with that baby, and how we teach them how the brain develops because of that. All the synapses are firing. And the more you interact with your child, the more that child's going to be actually ready for school. We promote optimal child and family health, development, and safety. So we want to make sure that for one thing, that moms get good prenatal care, because that's the most important thing in the beginning. Then we want to make sure that everybody in the family has a medical home. Everybody in that family who lives in that house, that child affects that child. So we want to make sure that anybody in the home that has any need, that need is being met. And the first thing is making sure they all have a medical home. We want to make sure that children are up to date on their immunizations because that's very important. We teach nutrition. We promote breastfeeding, all the things that are very important to a child's health and development. We enhance family self-sufficiency. We do this by encouraging them to go back into school if that's what they need. We encourage them to get into a job placement, a job training program if that's what they need. We also want to make sure that they understand how to access services in their community. We advocate for them. We make sure that they are, that they have safe housing. And as I said, we sometimes go down to DSS with them or family court, things like that, so that we can show them how to do it. Because our goal is that in 5 years, this is a long-term program. I should have said that in the beginning. So from the time the mom is pregnant until that child is 5 years of age, we can be with this family. So our goal is that at 5 years, a family can handle a crisis on their own, that they know what services are in their area, that hopefully by then they are employed and, doing well. Luann, I like to share the story now because Luann bumped into somebody at your doctor's office, right? She turned out she was the nurse at the doctor's office, and she was actually in our program. And how old was she when she had her baby?
13.
13 years old. So it works. Sometimes people just need that. I mean, I could have used a little support. We're a support system for families. That's what we do. We also, again, the last thing is to prevent child abuse and neglect, because that's what it's all about. To making sure that parents are successful. We want to keep families together. Nobody has a child and with this dream of abusing their child or neglecting their child or doing something that they shouldn't while they're parenting. It happens. So what we want to do is try and prevent that. So I have a few stats as well. So for this year, we completed 4,595 home visits. And since the program's inception, we have completed 146,083 home visits. Well, it's because we've been around a long time. So that's why. The state also did a study on home visiting on healthy families. This site, the Buffalo site, is the site that drove the study because we contributed the most people to the study. So it was Erie County, so that's us, Rensselaer County, and Albany County. Erie County alone gave 600 participants to this project. And again, we're the biggest program, so we have the capacity to do that. So we had to bring in 300 families that were going to receive home visiting and 300 that were not. They were in the control group. And that was very hard for us because there were families in that control group that could have really used the services as well. And we were only allowed to link them to certain services. So out of that study, it showed that 48% reduction in low birth weight when people participate in our program, 50% reduction in subsequent confirmed child protective services and reports, 49% reduction in the rate at which children of young first-time moms who enrolled early in pregnancy were confirmed as victims in CPS reports between ages 5 to 7. At ages 1, 2, and 7, Healthy Families New York mothers reported committing 75% to 88% fewer acts of serious physical abuse. 2.7 times more likely to be participating in a gifted program by age 7. 26% reduction in receipt of special education services by age 7. Again, we do a child development questionnaire, making sure that they're on target. And if they aren't, we refer to early intervention programs. 23% reduction in below average scores for receptive vocabulary for children of young first-time mothers who enrolled in the program early in pregnancy. At age 2, home visited mothers were more likely to endorse appropriate limit setting strategies. At age 3, home visited mothers were more likely to be observed using parenting strategies that stimulated the child's cognitive skills. And at age 7, home visited mothers used nonviolent discipline strategies more often. So it takes about $1,000 to serve a family during pregnancy and is totally recovered before a child's birth due to reduction in low birth weight. So prevention is actually cheaper than reacting later on in life. And for mothers with histories of CPS reports, there was a return of over $3 for every $1 invested by child by the child's 7th birthday. So not only are we helping build families, but we are actually saving money when we invest in programs like ours. So I'm sorry if I'm rattling off all those numbers. You can look on the Healthy Families New York website. It's healthyfamiliesnewyork.org if you're interested in more of that. And I'm going to turn it over to Alex, who is who was a participant in our program, and who is now an employee of Buffalo Prenatal. So she can talk a little bit about our experiences.
You can come sit next to me. So, thank you, Anne Marie. So Alex, yes.
Good morning.
She's going to talk about her experience with Healthy Families, but she's now an employee with the Community Health Worker Program. And this is not unusual. Almost 20% of our staff are former program participants. And that's great because they can walk the walk. They've been there. They can really speak to. Okay, Alex, you're up. We just pulled her into this yesterday, so she.
I wrote it down just so I won't forget anything. So I'm just gonna go ahead and read it. So good morning. My name is Alexandra. I was once a participant of Healthy Families. Enrolling in that program was one of the best decisions I've ever made. At the time, I was a mom of a preemie, previously in domestic violence situation, and I was so devastated and scared of the what ifs. Gonna happen with the baby? What am I gonna do? All the night. The Healthy Families worker that I was assigned to was like enlightenment for me. Buffalo Prenatal Perinatal Network as a whole is such a great program because it's like peer pressure, but to do the right things. Like gain knowledge about child's development and what is most nutritive for both mom and child, in its entirety to be successful as a mom first. Majority of people get frustrated or don't care when a mom complains about being a mom, and they just respond with, well, why you have the kids? But not these ladies. They actually take the time to listen and make you feel like you matter, not only as a mom, but as a person as well. The program helped me with baby care necessities when I was stuck in a pinch. They helped me with housing benefits I didn't even know existed, got me on track with all health appointments and finding a job, hence me being here. They did everything they could to help me get on my feet and finally be stable. So it led to getting an interview with Pitch as a community health worker. It was known as Mitch First. By the way, I totally crushed it.
Of course you did.
And I put my associate's degree in child development to use. It's so special when you were a client to now being the worker, because when you share that with clients, it gives them hope that they can also be great influence on others, as well as feel empowered in themselves. The struggles we used to face are now actually helping us navigate and direct other moms. I truly don't know where I would have been, especially mentally, without the program. Also now, as a community advisory board member, it brings more meaning to what we do, because now we can share our concerns and hardships to those that don't have our struggles to make changes in a way that can truly benefit the community and get to the root of our real needs. Having this position at Buffalo Prenatal was truly life-changing for me, and it continues to be as I'm a lactation consultant in training and a future doula. Thank you.
Thank you, Alex.
So one more thing. So we have one of the groups, we do a lot of different groups. We have all kinds of support groups. We have a scrapbooking group. And so my admin assistant is very talented. She's taught all the moms how to scrapbook so that they have pride in their pictures of their children and things like that, and how to make cards and all of that. So we have a card made here for you guys. It's thanking you for supporting our families, and it's a little slide out. Or I think it already did slide out. I don't know how to use it. Oh, there it is. I'm not.
That's why Marilyn does it and you don't.
And then on the back picture of some of our families who graduated from the program. I don't know if I'm gonna have enough for everybody, but should be a really good turnout. I think. I don't know if you want to take one for office or something, but pass them down. I'll let you guys just pass the box around.
Thanks, Anne Marie.
Thank you,
You're
Anne Marie.
welcome.
I just wanted to mention before I bring Makia up, is that Alex referenced the Consumer Advisory Board. That is something that is required in our new pitch grant from the Department of Health, but we have always, it's basically graduates or current clients of our program, because we've always felt it's important to listen to the people that are in the programs. We shouldn't be determining what people need, because we're usually wrong. I'll tell you that. So the Consumer Advisory Board's been in existence about 5 months. They do, actually you have a meeting today, don't you? They have a meeting today, but it's a good group for us. We're teaching them advocacy. They're giving us feedback. We just had one of the pediatric dental students come over like last month or the month before and had developed this brochure, and the clients pretty much tore it up. Because, you know, they looked at it, and if they can't understand it, then our clients are not gonna be able to understand it. So thank you, Alex. Okay, Makia, you're up. Makia's pinch hitting today because Marissa Sanchez unfortunately is sick, our program manager, but she's gonna do a wonderful job.
I'm gonna try my best. Buenos dias. Good morning. It's Hispanic Heritage Month.
That's right.
So yeah, I'm here to stand in for Marissa to represent the community health worker program. And please just bear with me. Allergies have been rough on me this year. I'm one of the supervisors. I also am an assessment worker. So this little spiel that I give you, I give to the clients every time I open a case. So again, we're the community health worker program. We parenting and pregnant case management. We service, like Luann said before, Black and Hispanic, the population. Our primary goals are to focus on the healthcare first, right? So prenatal care, primary care, oral health care, well baby visits, immunizations. And then once we can get those goals, primary goals set in place, we can work on the secondary goals, which is like housing, baby care items, things that moms need to be stable. And we stay with them up from pregnancy to 2 years, so that they can, just kind of be stable. If they need an extended time, we communicate with our program manager. We are the best community health worker program out there. We say that all the time. So we offer a number of support groups. We have the breastfeeding support group. I'm also a lactation consultant. So me and the other staff ladies, we've been training and leading these programs. We run a nutrition group. We have an empowerment group that our other supervisor, Maribel, leads with a licensed mental health counselor. And it's really a intimate group where they can kind of just discuss the things that are going on. We link them with services outside for mental health counseling. We're big on the mental health counseling component, and just wanted to be a support. Just like Healthy Families, we work with these families. We are in the home. We, try to do our best to assist them with everything that they need with the close case management.
And where do you find your clients?
Oh, we find our clients from outreach, door-to-door outreach, clinic outreach. We have a lot of people from, what is it? Lost my train of thought. OSHI.
The prenatal clinics.
Yep, the prenatal clinics. We also get them from CPS, and we have, just a number of WIC.
Mm-hmm.
Yeah. Yep. We get them from WIC. So we just mainly the door to door, because we can go actually to the door. And like I tell a lot of people, is sometimes you go to the door and there's a mom laying on the floor, no bed, no prenatal care. We link them with the service. That's really important to try to get them that prenatal care in that first trimester. Okay.
And I see you did fine.
Okay.
And I'm just gonna give a couple more kudos to Pitch. They were the driving force. In August, we became a certified baby cafe, and this group actually drove that. So a baby cafe, for those of you who don't know, it's a support group for moms who are breastfeeding. So we run it at certain hours. People can come in, they can get help with, latching on, whatever issues they have. The empowerment group is really important. And I didn't mention this, but both the programs we screened for depression, substance abuse, and domestic violence. And it's probably like 5 or 6 years ago. And it was in the Pitch group. First, we noticed all these women were scoring very high. We use a tool called the Edinburgh scale. High for depression, but they are very nervous about going to a counselor because they're afraid someone's going to take the baby away. So what we did is we contracted with Horizon Health. So the mental health counselor that Makia mentioned, and we're going to be starting a group in Anne Marie's group, because unfortunately it's an issue. 30% of women experience postpartum depression, for those of you who don't know that. So This group allows them to talk through, get some strategies, and our real goal is to get them comfortable with counseling so they can go to individual counseling. So I wanted to mention that. The pitch group also worked during the COVID pandemic with trying to get education out and vaccines. They worked with Connect, which is another CHW group in the county. So they're boots on the ground, just like Healthy Families is. I think the important thing I want to say about community health workers and family support specialists, and it does drive me crazy when people say they're community health workers, but they never are out in the community. Our staff are out in the community and they're in people's homes, which is a privilege for us, but it also gives us a very different aspect of their lives. I mean, people can tell you whatever they want on the phone, but when you walk in their house and you see them laying on the floor, or you open the refrigerator and they don't have any food, it's a totally different thing. And they really have to gain trust with these clients. I mean, they're very not trusting about, they've been burned before. They don't really want to believe what our staff is going to do for them. So we really have to earn their trust. Did you want to add something?
Build on that, sometimes people are really afraid to act, and when we're in the home, we can see the environment, we can see what's going on. And we can just like, it's okay for you to ask us to help you with this. It's all right, we can do something about it. We have information and we can provide that mattress for you or that bedding for your child. So it is important to be in the home, understand it gives you that whole picture of what's going on in that home environment. And it's very helpful.
Right.
When you're providing services.
For those of you who are agencies or referrals, you can go to our website, bppn.org. The referrals are online. I'm going to start my housing rant now because I know Schneckowski's into this. We had breakfast about this a while ago. I will tell you that it has become, I think during COVID, housing is not our primary mission as our agency, but it has become one of it. And I think during COVID, our homeless numbers tripled. We had a woman who was living in a car with her 2-year-old for like months and months. And I will tell you that the apartments that my clients are in are horrendous. And I see they're doing the Perry Street projects. I don't want a lot. I want an apartment building for families. It's wonderful that they do apartments for seniors and vets. I'm not begrudging that, but nobody has safe, affordable housing for families. I mean, you wouldn't believe some of the pictures. We don't put it up there, but I've shared this video with Dr. Taylor from UB because, my staff loves to send me pictures of the ceiling falling in and the rats, and it's unconscionable. And the rents are out of control.
Families can't. My daughter works for the Department of Social Services, and she's always complaining about the fact that even DSS can't give them enough money to really make the rent. It's ridiculous.
I can't tell you how many beds we buy here, and I ran out of money. So if anyone's got any contributions, we buy beds, we deliver them to them, we buy refrigerators. This is like basic life needs. How do you expect somebody to cook for their family when they don't have a refrigerator or a stove? So whoever's out there that's listening, hopefully one of the big developers that will build us a building, because we could fill it in a week. It's ridiculous. And as a city, I love all the development, but the fact that there are still people suffering in the city is ridiculous. So that's my rant. That's all I'm going to say. All right.
But we want to work on it. So please.
So please, whatever you can do. We brought HUD in here. We brought the state attorney general. We were part of some of the changes in the rental fees because we took them on a tour of some of our clients' homes, and they were horrible. It was pure silence when we walked through those homes. I'll tell you that. So anybody who wants to work with us on it, that is my rant. Okay.
Maybe share real quick about the relationship with the city inspections.
Yes.
That's been a very successful endeavor.
Yeah. Pitch has been very involved in the housing project. And now, because again, our clients, it's kind of like, would you rather not have a house or at least have a roof over your head? So they stay in these places because they don't want to complain. So a couple of years ago, through some funding through the Community Foundation, who've been very good to us, we were able to put a housing person, and she's out in the hall right now, I see her, but we now have a connection with them where we can call them and have them do an inspection. They aren't going to open the door to the city inspectors. They will open it if my community health worker is with them. And then we can at least cite them, but it's still not enough because some of the landlords don't care. They'll get cited and it's like, whatever. So it's like this between a rock and a hard place. But people are trying to help us through the city. I think we could do more, just my opinion. And but they've been a really good partner with us. And you know, it's like I said, it's hard to talk to people about health when they don't know where they're sleeping at night. It's just, you know, it's a basic need. And I don't understand in a city of Buffalo why we can't tackle this issue. Okay, rant ended. Okay. Terry, come on up, please. We're gonna move to our fatherhood program. So we started our fatherhood program in 17, because as I mentioned, I felt like we were missing a big part of the family, a part of the population. And dads are not all deadbeat dads. There's a lot of dads who want to be involved with their families. And we as a society have not always made them feel welcome. You know, think about when you take your child to the pediatrician office, there's one chair for the mom. So we started this program. I was very lucky to hire Antoine Johnson, who's actually on paternity leave with his second child. He wasn't even a dad when I hired him. He's got 2 now, but he's been a real force behind this program. And Terry is one of his able assistants here. So he's going to talk because Antoine's obviously out with his new child.
Yes, he is. Good morning. Good morning. My name is Terry, and they gave me a title of Senior Fatherhood Advisor for the Buffalo Fatherhood Initiative. You know, time don't allow me to tell you my story because my family was former clients of Buffalo Prenatal Perinatal Network. And that's a story in itself. That's how I got here. But I'm sure everybody in here agree that fathers are important too, right? And they don't have to be what they call the invisible parent, but they have to do that part, which is stepping up, showing up, being engaged with their children. And what the Buffalo Fatherhood Initiative do is engage with those dads so that we can help them more effectively engage with their children. Whether they come by referrals or from different agencies, organizations, or in-house, or we have whole events and we recruit, or we put on a program, which may be a fatherhood class that we do. We take them all. And what we do is, first, we help them meet whatever needs them and their family may have, you know, guide them to resources. Then we, you know, enroll them into a program. Our fatherhood program, we teach them the skills to help them to become, first of all, the best man that they could be. And then that allows them to be best father, partner, husband, you know, friend, whatever. And our program is a 13-session program. You meet the criteria, you get a certificate of completion. Our Nurturing Fathers program, so far this year, we've held 6 classes. 2 of them have been inside the Erie County Holding Center. We've held them at Buffalo Public School, the high schools. We have completed 2 8-week study programs with Florida State University, Florida International University, looking at early child development and detriments of health. We have a class currently in progress, and we have 4 more are scheduled to start this year. So it's been a busy year for the Nurturing Fathers program. We also have a Financial Peace University, which is a 9-session financial management program where it teach you how to budget, how to get out of debt, how to save money, start a savings, and how to be charitable with what you have left over. We also have a mentoring program. Currently, our mentoring program, we're in partnership with a college. We're reaching out to the young men in the college. But with that being said, the information on our program is inside your folder. Please take the time, look it over, give me a call or send me an email, ts@bppn.org if you have any questions. Mm-hmm. And I would like to bring William up.
Thank you, dear.
All right. Oh, I'm sorry. Antoine will be very upset if I didn't remind you or let you know, October 12th
Our
is our
conference.
4th annual fatherhood conference. All right. Hopefully you have all been on one of our mailing lists and are aware of it. If not, please reach out to me so that I can get you the information. We would love this.
It's in the
It's
folder.
in the, here you go. Yes. So please, register. Look to see you there.
I was gonna say before William speaks, when we started the program, I went to some of the classes and I thought they're not gonna talk in front of me because I was like the only woman in here, but it's a very mixed demographic. There's young dads, there's old dads, different races, but I'm telling you, they are very chatty. I don't think they have another forum to talk about this kind of stuff about their kids and whatever. So it's been a really great addition. Okay, William, you may have the floor.
Right, good morning. My name is William Yoder, and I joined Nurturing Fathers. I met Terry at we were at Bennett High School passing out brochures to get people involved. And we started talking. I told him about the school I'm with, Reach Academy Charter. And we're in one of the poorest communities in the city also. With the Nurturing Fathers, we went to Cradle Beach Camp. And we had about 30 young men from the age of 14 to 24. And for them to get out there and talk about their problems without a father, without a male figure being involved in their life. That's something that really struck home to me because I didn't have a father in my life. Not that it mattered because my mother was a strong woman, but to see that it's still going on today. So with Nurturing Fathers, I joined it because I have 790 grandkids. I'm the grandfather of Reach Academy Charter. I am the mentor of Reach Academy Charter. Sometimes I'm the only male figure that has a positive attitude in the kid's life. So what we do is exactly what you're talking about doing, and I would love to talk to you more about it. But we have families living in hotels. We have homeless families. We collect furniture. We do as much as we can. And with Nurturing Fathers, what I like about them is that we come in and we talk about our problems. You know, sometimes men figure they don't have a problem. But men need a place where they can actually go talk and express their feelings. And with Nurturing Fathers, that's what we do. There's a lot of tears shed, but the truth comes out and you feel welcomed by being in a place where you can express yourself because men are supposed to be Iron Men. We're supposed to be the strong. We're not supposed to show weakness, but we have it. So in Nurturing Fathers, what we try to do is let men know it's okay to be weak. It's okay to ask for help. And with the kids that I'm involved with, I'm the father, the grandfather, psychiatrist, the internist. I mean, kids come to me with problems, father in jail, a father out of town, and I'm mad because of that. So my job is to be that strong male figure, to listen to them. And Nurturing Father provide me with the tools I need and information I need to do even better than I'm doing. So if you can visit these kids, talk to them. And one of the things that I do, I talk to them and not at them. And as an adult, we all sit and talk about what we want our kids to do, but to actually be involved with them the same way when you go out to their homes and you see the needs of the family in the home. Unless you get involved with the situation, you really don't have a feel for it. I'm involved with the Fillmore Broadway community, the East Side. I've been to the March on Washington, you know, when I was 13. My mother put me in programs. My mother taught me about giving, and that's what Nurturing Fathers do. We give our heart, we give our time, we give our energy. And we're talking to these kids and you listen to their stories. You develop a relationship with them and they tell you how they're living. They're telling you I can't have food to eat at home. They tell you I don't have clothes. So what we try to do is provide it just like you guys are doing with you. Nurturing Fathers is a wonderful program. And it's not just because you're a father and you think you're successful. If you're that successful, pass it along. Come inside and talk to us. And we invite women to come too. Everybody needs to know what's going on. And what we're trying to do is erase that stigma that men can't cry. Men are not supposed to show shame. Men are supposed to always be right. And in reality, outside of that, men are not that stuff. And everybody knows you're not this, you're not that. So what we do is provide a positive energy for the fathers that come there. I'm a mentor to kids in the street, kids in different neighborhoods. I go to parents' homes. But in order to help the community and get rid of that stigma, we need to be more involved. And I'm so glad that that's what you guys do. Because I too go to homes visiting. And it's not an easy task. You have to win the customer over. And they have to really believe that you care about me. And that when you care about me, it's not going out in the street, hey, you know, so-and-so live in a raggedy house, so-and-so lives like this. No, it's about so-and-so needs help. And I'm going to be that person. And it's hard to be one person or one organization with as much people out there that needs help. So again, that's about all I'm going to say, but I could talk about this forever. But just get more involved. And when you see a kid on the street, say hello to them. Thank you.
Thank you, William.
Thank you.
You know, we've also been very lucky, and Terry's an example that some of the our facilitators came from our classes. Terry came from our class, Mike McKnight, who's one of our facilitators. Denise's husband is one of our facilitators. Actually, one of the gentlemen that was in the holding center is one of our facilitators now. He's out, he's doing well. And he obviously can speak to that experience. So thank you. That was really, really great. Questions? Do people have questions before I go off on another rant, I'm sure, about something?
Or comments.
Or comments.
Observations. Don't be shy. You are not a shy
Mhm.
group of people. One-on-one, I know.
Yes, Jessica. Yes.
About, some of the household items that you guys are looking for.
Yes.
How do you reach out for those items? Is it an annual, outreach effort? Is it just by word of mouth?
Mostly word of mouth. In fact, I have a list piling up. Usually, once I have somebody that donates, they'll tell their friends. So our biggest needs, besides the beds, couches, dressers, and just household, because we're a lot of times we're kitchen items, because a lot of times our homeless, they don't have anything, so they have to start off fresh. So it's mostly word of mouth. We have it on our website too. But and people during COVID were cleaning their houses out, so we were really lucky because that really helped us. But as long as it's in decent condition, but we also take baby items that are gently used, clothes that are gently used or new. Trying to think what else. That's pretty much it. Linens, towels, all the basics to start a household. That's what we take. Any other questions or comments?
So we would welcome anyone who has access to, a forum to kind of advertise and promote for us. We would appreciate that. Not only the programs, but the needs for the clients, right?
Right.
Great.
One of the things I was just going to mention, with my council members office, we have a newsletter that goes out to 4,000 constituents, and a lot of the information you've included is really great. Do you have PDFs of like a lot of this stuff?
Yes, we do.
Okay.
Right. So if you see me after, and I'll get your contact information, I can email you.
You all have my contact information.
Or
'cause I
contact
contacted
Denise.
you. So
Oh,
you
yeah.
just hit reply, tell me what you need or want, and I'm happy to get you whatever you need. If you want us to just, you want copies, you want to email it, you want us to come and talk with someone, whatever you need, however we can work together, you just let us know. We will do it. It's not a problem.
Any other comments?
If not, we can start seeing who is paying attention and see if we got any bingo winners.
Go ahead, Denise.
All right, here we go. Now so no one would cheat now. So there are 5 different cards, so not everyone's is the same. So if you got a bingo, call it out, because I do have prizes. So true or false, Buffalo Prenatal serves 800 families annually. True or false? Did anyone write it down with an answer that want to share? Don't be shy. You get a 50-50 shot.
It's true.
It's absolutely true. At least 800 families a year, for sure. All right, how many programs does Buffalo Prenatal have? Say it. You're right. Three, absolutely. Right. We have our 2 maternal programs and our fatherhood. Absolutely. What is the cost for our Buffalo Prenatal programs for our clients? Free, absolutely free. There is nothing that we do that costs our families money. Absolutely free. Buffalo Prenatal provides maternal home-based programs. True or false? Are we home-based?
True.
True, absolutely, 100% true. It really makes us a little different because there's not a lot of home-based programs.
There are though.
There's
There's
some. No, I'm saying there's some, but there's not a lot out there.
Bingo. All right. 2 bingos.
Right now. All
There,
right.
yeah, there are other home visiting programs. Not all of them deal with the same population that we deal with.
You want a big envelope or a small envelope?
That group from charter school that are here, health charter school,
Right.
would they have a community health worker placed in the school, or do they just?
I'm gonna talk to them because actually the social worker reached
So
out to me and left their
all right, so
message.
let's see.
Okay,
I
great.
got one more prize. Where did I leave off? You can submit a client referral on our website, wbbpn.org. True or false? Absolutely true. And you can designate to which program you want it to go to. And if you're not sure, just fill it out. We'll figure it out.
Yeah.
Another bingo.
We got 2 bingos. That's all right. You know what? I'm going to take care of both of you. But we'll continue on.
Okay.
You know, the one thing I didn't mention, which unfortunately where this program is going to be ending in the next year because we don't have any funding. So anybody have any funding options? We started a couple years ago a program. It actually was started with United Way through a federal grant. It's called Go Buffalo Mom. They had done focus groups and realized that a lot of our clients, one of the issues they have, because we're so big on prenatal care, is them getting to the clinics. You know, people don't think about it. You just jump in your car and you go, but you know, you're 6 months pregnant, you got a 2-year-old, you're trying to get there, you don't have a car, you're getting on the bus, and you wonder why people don't show up for appointments or they're late. So this program started, we ended up taking it over in collaboration with United Way. So I have 2 transportation navigators that actually sit in the prenatal clinics at the Catholics in Calida. And they work with the moms, you know, either getting them bus passes or Medicaid cabs. I was just running the numbers last night just for this year because, and the goal is obviously to get them to full term. And as I think Anne Marie mentioned, every time we get a mom to full term, I wish there was insurance companies here that they could hear this. We're saving, you know, a NICU stay. I worked at Children's for 30 years, so I know these numbers. $1,200 a day to stay in a NICU. So every time we get a mom to full term, we are saving a lot of people money. So that's why people should be contracting with us, which is my other vent. The grants are great, but if you lose a grant, you lose a program. We need to have unrestricted money in order to, number one, get my staff to the salaries they deserve to be at, because they all should be making $1 million. And my staff starts at $15 an hour now. They could go work at McDonald's right now. So that's my other rant. It's important that, so with Go Buffalo Mom, I think the numbers I ran last year, like 80, now obviously I can't take credit for all the full-term babies. I mean, there was other factors, but 85% of the moms from this year delivered at least at 37 weeks. That's really impressive. So unfortunately, the program is the funding ends the end of this year. I'm just applied for another grant, so hopefully I'll get it. But I forgot to mention that. Amy, you want to add anything?
No, I to only amplify that the care that the moms receive in advance by our program, we cannot underestimate the stress that all families are under. We feel stress. We feel that, and we have a tremendous amount of supports around us. Buffalo prenatal, perinatal team members are that family, are the friends to these moms who need that support. So I think it's just wonderful to point out that sometimes you need a friend. And that's part of the work that we in fact do for these moms. So we hope that you will consider us your friends and that you are obviously all of our friends, not just on behalf of our agency and our great leadership and staff, but on behalf of all those we serve. and in particular, the entire family, dads and moms. So we want to thank you all for being here. We are very happy to represent this entire piece of information at any point in time to any of your agencies. If, again, you thought that the holidays, you've got everything you need and you'd like to join us and adopt a family, that would be wonderful. But even if so far as during the middle of the year, you would like to donate a bed or a refrigerator, et cetera, we are always willing to be creative and work with families that want to be generous to our families. So, okay.
Thank
Just
you.
so you know, just to give the answers to the rest, we have our bingos are done for the prizes, but can you follow us on TikTok? No, we're not on TikTok, sorry, but we are on Facebook, Instagram, Twitter, and LinkedIn. So please follow us on those platforms if you're on them. Can father figures and guardians participate in the fatherhood program?
Yeah.
Yes, resounding yes, absolutely. You don't have to be a father to be part of the fatherhood program. And BPPN has a staff of 35. True or false? False. No, we have 52, 53. Yeah, so we're definitely more than that. And what year was BPPN established? This one's a little tricky. Come on, Luann, tell them.
87.
1987.
1987. So you've been around a long time. So thank you. Please, if you haven't, please
Before I was born.
fill out the engagement survey. Let us know how we can work together. There's 3 other categories. You guys have creative ideas. Let's talk about how can you help us, but how can we help you? Because we help each other, we're helping our community. So, check off, get creative, let us know other ways, drop that off to us, please feel to, chat if you can. If you didn't get a folder, please grab one. Please get coffee to go, juice to go, whatever. But we do appreciate your time here today, and don't be shy if you need anything. You all have my email. So
Did you have a question?
Yeah, that was a question. My name is Naija. I'm from the Burn Leader Crystal People Soap Office. So I'm not familiar if y'all work with Service Collaborative. I may have a best for Buffalo.
They do. Well, they do. We have worked with them in the past, but we actually have been working, I should have mentioned them because they're a big supporter. We actually have been working with Sleep in Heavenly Peace for the kids' beds. They've probably given us 50 beds. And it's a great organization, but we have worked with Service Collaborative for beds too. Actually, I have to reconnect with them because I haven't talked to them in a while. That's a good point. Thank you.
A lot of donations, maybe that's something we might decide to do.
Oh, that's a good point. Yeah, I know somebody over there.
Household items.
That's a good point.
Oh, great.
And I wanted to mention, just touching on what Denise said about working, a family is not always a mom and a dad. Sometimes our families are grandmothers or aunts. So whoever the primary caregiver is, that's who we work with. Because we know that there's a lot of times that it's not the biological mom or dad.
Anything else?
Okay, we're here if you have questions. Thank you so much for taking time this morning.